Advances in Health, I'm Rebecca Stewart. 54 million Americans suffer from some sort of arthritis, and the pain can be debilitating. But there is hope. Dr. Pravda joins us from the Connecticut Orthopaedic Institute at MidState Medical Center, and we are going to talk about total knee replacements.
Total knees.
Take us through what we're seeing.
Well, this is your standard total knee made by many companies, but essentially we've taken somebody with an arthritic knee whose knee is worn out, no different than your car tire losing its tread, and we've put a new knee in. We've resurfaced the end of the bone. We cut the end of the bone in a special manner that will accept a cap. And we take the bottom of the knee and we put a metal and plastic piece on like that. So we have an articulation that's now metal on plastic. But we've revised the whole knee. There's no cartilage left. The entire knee's been replaced. Many of the ligaments have been removed. And you end up with a knee that bends, metal on plastic.
It's amazing to see, and you say it so matter-of-factly, how life-changing, life-altering this can be to a patient who is in so much pain.
Yeah, it gets most people back to normal activities at almost every age. It lets the elderly walk. It lets the middle-aged play sports. It allows you to go back to do the things you want to do and live your life the way you want to live it.
And are those sort of the gauge questions that you ask to make sure, say, who is the candidate for something like this?
Someone who has arthritis, where the arthritis is interfering with their activity of daily living or their lifestyle. It's a lifestyle choice.
Wow. Dr. Pravda, we really appreciate it. For more information, be sure to log on to WTNH.com/advancesinhealth. I'm Rebecca Stewart.